What is the culture like at HMSA these days? You've gone through this sort of big evolutionary step as an organization, and so what is it like to work there, to be a part of that today versus 3 or 4 years ago when it was just coming together?
Well, I think we're in the middle of an internal transformation ourselves. We have great employees, right? They're dedicated to the mission and purpose of our organization. They really want us to succeed. So they're kind of used to doing everything that's thrown at them and in their direction. And it's created people trying to do incredibly important, massive transformational things off the side of their desk, because they have this to do and that to do and this to do. Oh, and by the way, I'm going to try and integrate with a big health system at HMSA. So what we need to do is, and what we're working on now, is evolving the culture to involve some focus, to involve people specifically having big initiatives that they're responsible for and trading off other things that they used to do to others in order to get that done.
Yeah. So as you know, this is our 4th year hosting State of Reform, and 4 years ago when we first started, there were a lot of questions and concerns from the provider community, from physicians in particular, about the direction of a more capitated or global payment methodology, particularly for primary care. As a physician, executive, and leader, how would you characterize the sort of arc of that physician level of buy-in and level of engagement in this transformation work?
You know, let me start a little bit back with the rationale. So I think the HMSA and the delivery system, for the last decade, I think we've been focused on quality. And I think we're winning that game. I mean, I think when you look at every measurable metric about how the state of Hawaii is doing in terms of quality of healthcare, we're doing well. Mm-hmm. So I think we're winning that game. The game we're not winning is affordability. The game that says, okay, you're delivering quality outcomes, it's really good and everything, you're still eating up 18% of the GDP, you're still one economic downturn away from a disaster for everybody to have access to healthcare. So we got to get control of that. So aligning with the delivery system as a health organization / payer that we are, of aligning incentives and saying we're all shooting for the same thing, we're all trying to work within a budget, we're all trying to create this quality outcome within an affordable model of care, is the reason why we started that approach. It's a challenge because it's different from everything else we've done, and you know, we did that with the primary care docs. We're working on value-based payments with our health systems so that their revenue is not just purely based on filling a bed, but on ways that they also manage their population. All of these things are challenging on everybody, but at the end of the day, you know, I don't know if you know this, but my background is, besides being a doc, I was a coach. So I love the fact that we're in this team-based kind of thing now, where that's what we're all trying to do. And you really need to leverage the whole team if you're going to win, if you're going to be successful. And the delivery system, the docs, the hospitals, they're kind of the stars of the team, right? They're the Patrick Mahomes. I'm a Chiefs fan, so they're the Patrick Mahomes of the game. HMSA, we're the blockers, we're the offensive line, and we got to block to make them win. But we got to facilitate them succeeding. But we all got to be on the same page, trying to win the same game. And that's the whole idea behind alternative payment models, behind value-based payments, is just aligning incentives so that everybody is on the same page trying to win the same game.
So is football what you coach?
No, I coach basketball.
Basketball.
Yeah. I'm just a Chiefs fan, so I'm all excited because they were pretty amazing this week.
I'm a Seahawks fan, so I'm miserable. I was going to ask you a question about Andy Reid and coaching, but I'll ask you about...
That's a bad subject. Don't bring that up.
I will ask you, though, about basketball and coaching, because I think that there are very few opportunities for peer learning amongst leaders. That's why I like to ask some of these questions about leadership. But that leaders are often trying to learn from a wide range of different sources of leadership. And so it may be that basketball coaching or leaders from sports are informing, your view. And I thought I'd just ask about that. Are there folks that you've learned about or learned from as a coach or otherwise that inform the kind of leadership style that you bring to HMSA?
Yeah, I think there are all kinds of different coaches and leaders in the world that range in styles from very authoritarian to those that are much more collaborative and willing to delegate. I've always felt, and my own bias has always been that you're much more successful if you delegate responsibility, if you collaborate, if you bring everybody involved in the decision making. I try and bring that to HMSA. I try and delegate decisions down to the level that's appropriate. Not only do you get better decisions there, but you're also training the next generation of leader, right? If you give somebody the authority to make a decision and then to follow it through and then to kind of motivate the group under them that they're in charge of to deliver, you develop that leadership skill that you need for our next generation of leaders.
Yeah. So how do you translate that into the public policy space? I mean, your job is not to necessarily go meet with every legislator or to the governor, but HMSA is obviously has an outsized role in terms of its ability to constructively impact the public policy conversation. So how do you see HMSA's role in terms of partnering and collaborating and sometimes pushing back against policymakers?
No, that is a huge role, and my team is right there. They're sitting there. That again, we in my delegatory style, I like to I'm obviously very involved with them, but they are responsible for getting our perspective out there. It is incredibly key. About 4 years ago, we launched our strategy, which we called it Mugiishi, which is the idea of transforming our community so that each of us as stakeholders in this game of healthcare, we're all responsible for bringing what's important to us to the table so we all understand each other's perspective and then we become aligned toward the same objective. And government and employers and providers and us and the communities all have to be involved in this. And government policy obviously is one of those critical stakeholders. So, I think they recognize that, the government does. They are always seeking our input. We're always willing to give it. And I think they hear input from all the different stakeholders as well.
Yeah. Give us a window into how employers are thinking about healthcare these days. I think on the one hand, HMSA and Hawaii in general have done really an outstanding job controlling costs and doing everything you can with access in a tough situation in terms of being geographically isolated. Are employers just, are they complaining about the high cost of healthcare because that's what employers have a right to do? Or are they a little more appreciative? Do they understand the nuance and the sophistication that HMSA has brought to that challenge? Give us a window into those conversations.
So yes, employers very much are focused on affordability. You're right that we have done a pretty good job as a system here in Hawaii of controlling healthcare costs as compared to the rest of the country, but also prepaid healthcare, which is a landmark piece of legislation that was visionary and is great for our state in terms of making sure that we have good coverage and good access to healthcare, also places much of the burden of that cost directly and squarely on employers. And so they are obviously very, very concerned about the cost. And healthcare is not the only expensive thing. All of Hawaii in general is burdened with the task of addressing affordability as just a main issue for living here in Hawaii. Everything is expensive here. So, the fact that healthcare is expensive but maybe less expensive than the mainland is not a good consolation prize. I think they still expect us to try our best to control healthcare while guaranteeing good outcomes. And so that really is our focus as employers being one of our big stakeholders, obviously.
Yeah. Give us a window also into the Blue Cross Blue Shield Association conversations when HMSA goes back and meets with its peers, some of which are large multi-state like Anthem or HCSC, multi-state blues. What do you learn from those states that you can bring back to Hawaii and implement here?
So the Blue Cross Blue Shield Association is 36 incredibly disparate health plans, as you articulated, range from Anthem and HCSC, which are huge, to plans like Rhode Island and Wyoming that actually have fewer members than we do in Hawaii. So really what you have to do is you have to look in the 36 plans for plans that are similar to you in mission, in size, and impact, and all of those things, and try your best to learn from that. So we're very lucky that one subset of the Blue Cross Blue Shield is the Western Leadership Association, and there are a bunch of plans that, except for California, we're all kind of similar in terms of size and scope and what we're trying to accomplish. And there it's really easy to pick up different ideas that they have in terms of value-based programs, the way they contract, the way they manage their members, care management kind of strategies. That membership and getting that advantage out of the Blue Cross Blue Shield is equally as important as the fact that we get coverage for our members on the mainland.
Yeah. Laura spoke about the MedQuest RFP. It's a big, potentially significantly disruptive activity in Medicaid. What do you make of the vision, the aspirational vision that Medicaid has put out in that RFP, and what do you expect to see roll out in 2020?
Yeah, so I love that vision, and even before the Quest RFP came out, Judy Moore-Peterson spoke here, and she's spoken everywhere about her vision for what Medicaid would be, that it would be healthcare pushed upstream, into the social determinants, that we would be compensating the delivery system for that type of activity. Besides, because look, there's healthcare there's many components. There's keeping the healthy. There's taking care of acute diseases. There's chronic disease. There's really severe disease, and then there's taking care of things that aren't classically characterized as a disease, but they have more impact on health than anything else. And really, if you're going to do something meaningful for any big population, you kind of have to have an answer for all of those things. Yeah. And I think the Quest vision tries to get at all of that, and especially some of the newer pieces are making sure that, and Laura referenced this, that you're paying in a way that allows providers to deliver those services. So I think you're going to see all of that coming out of the Quest RFP. I think it's a great vision. We're hopeful, and we're wishing that we're one of the plans that gets to be part of the implementation. Yeah. And given that we have a lot of presence on the neighbor islands, we actually really hope that we're one of the statewide ones. But we know there are other great plans out there that are competing. So right now we can just keep our fingers crossed, kind of like hoping the Chiefs win the Super Bowl.
Yeah, well, that would be fabulous. Anybody but the Patriots. Thankfully, they're not in it anymore. What questions should I ask you, Mark, that I haven't asked you already?
No, I think we covered the gamut. I think if there's anything I'd like to leave the group is that one of the things that I always say as an ex-coach, right? Like, we're never going to win this thing with just one player. Even if you have the best player in the world, if that's all you got, you can't win. It really does take the involvement and the alignment of everybody in the room here, and that's why it's very encouraging to see all the people here attending this conference, trying to work together for a good healthcare solution in Hawaii that's affordable and meets the needs of all the people of our state.
Well, HMSA and Jen Diesman in particular were the first folks to sponsor us when we first got started a few years ago, and it's been meaningful, and we appreciate it very much. Let's give Mark a round of applause. Mark Mugiishi.